Let's focus now more on the issue of rising COVID-19 cases in Gauteng. We're joined by Professor Bruce Mellado, a member of the Gauteng Advisory Committee on COVID-19. Professor, a very good afternoon to you, and thank you very much for your time. Now, there is growing concern about the rise of COVID-19 cases in Gauteng. Are there specific areas where you are recognizing a potential high risk and escalating numbers?
Thanks for having me. Indeed, as the Premier already has indicated, and also the release of a press release on Monday, we are very concerned with the steady rise of cases in the province and also neighboring provinces, and also the fact that the increase of these numbers doesn't happen evenly. There are certain districts and sub-districts that are experiencing a sharp increase, even a quasi-exponential increase in the number of cases, and that tends to be a sign or an early sign of a wave approaching. So we are very concerned.
Talk to us about the area of Sedibeng, for example, which has been flagged as an area where the numbers are increasing, as well as Mfuleni.
Correct. We've been following all the sub-districts and all the wards of Gauteng for a long time now. We have seen, in particular, that Sedibeng hasn't seen the drop of cases that we would have expected in normal circumstances. We built risk indexes that tell us about the probability of resurgence, and the risk there has always been medium to high, and now is borderline high. So that's a very big source of concern, and has always been for the past couple of months. But unfortunately, that's not the only area or sub-district in Gauteng that now is experiencing increases. The one you just mentioned, Mfuleni, is certainly one of them, but that's not the only one. We do have other sub-districts in Johannesburg and Tshwane that seem to indicate that there is a steady increase in some areas in the province.
And what could these increases be attributed to, Prof?
Well, as you know, we've had a number of events that typically come with a lot of social interaction, such as the Easter holidays, such as the long weekend that we have. That gradually accumulates basically cases, and if in addition we see a relaxation of how people are adhering to social distancing, you basically have all the elements for a wave to come in. So what we are trying to convey to the population and all the stakeholders, that now we are highly vulnerable. The situation is very, very fragile. We see all the elements of an early wave looming, and we need to change our behavior as soon as possible and adhere to social distancing when required and necessary and possible in order to prevent, or worst case scenario, to delay a third wave.
So talking about a third wave, what would, as far as the numbers are concerned, what would constitute a third wave? At what point are we able to say now we are officially in a third wave?
There are different criteria that are used to establish whether we are in the middle or we are in the beginning of a wave. There isn't one, so to say, universally accepted one. So there's different criteria, different scientific approaches to it. Typically, when we see that several of those approaches coincide when it comes to the alert and coincide when it comes to establishing the wave, we typically agree that a wave is coming. To simplify what I just said, one can argue that when the numbers and a number of other indicators such as mortality, excess mortality, mobility, hospitalization, they're all in a correlated fashion undergo a steady increase for at least 2 weeks, you can actually be certain that a wave is coming. We are not there technically yet. However, given the experience we have with the first and second wave, we are seeing signs that the third wave may be around the corner.
What is your perspective regarding this, Professor? And we do have the benefit of hindsight, having gone through a first and a second wave as well. How do South Africans react to the type of information that you're sharing with us now? residents of Sidibeng, Tshwane, Mfuleni, etc., when they find out that there is an escalation of the number of COVID-19 cases, when they find out that they are now at an increased risk of actually contracting COVID-19 because it's spreading, is there a behavioral change? Do people actually start wearing their masks? Do they practice social distancing? Do they use their hand sanitizers? Or do South Africans need stronger measures to be put in place, like, for example, lockdown levels to be increased in order for them to effect any sort of change?
That's a very good question. Look, our job as committee members and advisors is to use all the analytics and other techniques, use science as much as possible in order to ascertain the risk of resurgence. And that's why we are going to the public and to inform the public that we are in a very fragile and very dangerous situation. It is very important that policy making and any advisories and also our interactions with the population be based on evidence, on scientific evidence, and we do believe that the early signs are on the horizon. Now, of course, what we do is we do this as early as possible. Our job is to ascertain, based on science, that something bad is coming, and we need to alert the population for it. Then, obviously, as time progresses and as we monitor the situation closely, policymakers have to take the evolution and the possible change in behavior into account. And if not, obviously, they will have to enact other forms of advisories or other forms of pressure. But what our job right now is to indicate and inform the population that the situation is very serious. And in the past, these kind of communications have worked, have given positive effect, and it's as a result our job to do so.
We've got the government's national vaccination rollout program starting on the 17th of May. How, if at all, will this impact the number of cases in Gauteng?
Vaccination is absolutely critical to reducing the severity of the disease. As you know, the government has a detailed rollout plan that will start in terms of the population with the most vulnerable folks above 60 that are most likely to contract severe disease and or die. And of course, that will have a very, very major impact. Now, as you know, the vaccination, of course, takes time. It's a very complex process. It's also hampered by the ability of manufacturers to provide those jabs. And it's extremely important. That's what we go to the population, to delay the third wave as much as possible. The longer we delay a third wave, the more lives we will be able to save.
Professor Mellado, thank you very much for your time and your insight this afternoon. That's Professor Bruce Mellado, a member of the Gauteng Advisory Committee on COVID-19, sounding the alarm there that the number of cases are rising and that we as South Africans really need to continue taking those necessary precautions, wearing the masks, washing the hands, keeping the social distance.